My name is Lauren McCarthy, and I am posting for Module 4 for our pharmacology class. So we were given the scenario that there was a 50-year-old female who was found in a park. She was found by a jogger, and when the jogger called 911 to help this woman, she became very combative. She was yelling about that she needed a bottle. She ended up falling and scraping her face and her arm severely. So when 911 arrived, she had thought that they were stealing her belongings. She mentioned that her purse was missing and she thought that they had stolen it. So based on my first impressions of the scenario that we read, I would think either two things. She was either detoxing or going through alcohol withdrawals, or she may be having early onset dementia based on her age, because she was only 54 years old. So some of the reasons I would feel that she was going through alcohol withdrawals would be that she had anxiety. It was mentioned that her hands were shaking. She was having hallucinations. She was very confused and also combative. She was very disoriented and also agitated with even the jogger who was trying to help her, and then also the paramedics who came to escort her to the hospital or get her some help that she needed. Dementia also at this age could mimic some symptoms. I mean, she did ask for a bottle. So, I mean, the scenario didn't mention if it was either a alcohol bottle or a bottle as in like she reverted back to being a child. So some of the issues with early onset dementia is confusion, difficulty with reasoning. She seemed very overwhelmed from what the scenario that we read, and also distrustful for the people that were actually there to try to help her, and also seemed like she was very paranoid as well. So of the two, because of her tremors and the shaking of her hands that was reported, I would say that it was more likely from alcohol withdrawals than anything. So some of the short-term effects, the short-term, what was the question? Health risks, that should be addressed are, is she going to go through DTs? How long has she been drinking? When was the last time she had her last drink? What other symptoms is she experiencing? Is she having slurred speech? Is she seeming very drowsy? Does she have feelings of nausea or vomiting? It was mentioned that she did have a little bit of distorted thinking because she did think that someone was stealing items from her. And I mean, who knows, because it didn't mention if she ever had them with her. And also, like, has she had blackouts before? Has she ever ended up in random parks, or, has become so disoriented at the end of the evening or a day, whatever it was, that she didn't know where she was and she needed that assistance as well. Some long-term health risks that could definitely be associated with alcohol use and abuse is unintentional injuries. So I'm pretty sure that probably most of us have had friends, either have DUIs or have gotten in car accidents after drinking, or have at least known people, whether it's family members, coworkers, anyone. I think it's an important thing to mention that impaired judgment is a huge risk factor of long-term abuse and use of alcohol. Some people think that, because they have a tolerance, they don't feel impaired or anything after, 3 or 4 drinks, when in reality their blood alcohol is a lot higher than they actually know. Other intentional injuries could be burns, firearm injuries. Alcohol also plays a huge part in relationships. So whether it's relationship with your families, romantic relationships, friendships. So, if people aren't on the same pages you and they're not drinking with you, that could have long-term effects, and relationships can be broken because of that. It could also cause problems within the body, so such as liver problems, liver disease, nerve damage, sexual issues, whether that's wanting to engage in more sex or in less sex and becoming impotent because the amount of alcohol that they've had. Also, malnutrition is a huge long-term effect of alcohol use. And also, there is other liver issues like alcohol, hepatitis, and also cardiomyopathy. So in terms, the question asked about why were her hands shaking, or what are possibilities of why her hands were shaking, or why she was combative and confused. Some of the reasons her hands could have been shaky was due to the tremors that come from alcohol use and abuse. It's part of the withdrawal symptoms. It includes some of the cerebral tremors, and also there could be enhanced psychological tremors. What else? I mean, that could also include a shaky voice, unable to hold utensils, or even a pen to write with, so difficulty in writing as well. Her combativeness could have been due to the toxins being released from her body. That is part of how DTs, which are delirium treatments, occur. And then it's also the hyperactivity of the automatic nervous system. And also with this, that could cause hallucinations and also cause some anxiety. Confusion, obviously she came to and she was in the middle of a park and some lady was trying to help her. So why that happened, she probably didn't know how she got there, which would be caused by the amount of alcohol she had been taking or from the last time she had her drink. So again, she was asking for a bottle. I don't know if that means she wanted a baby bottle, as if she was having early onset dementia, or alcohol, as if she wanted a bottle of alcohol to make it all go away. Part of the confusion could come from the levels in her body, so levels of magnesium and phosphate. Those are affected when someone is coming off of alcohol, so that could also be part of her detox symptoms. But again, for every person, it is always variable. So as for assessment needs, just to kind of sum it up, there are several opportunities and options out there for individuals who want to accept that they are either an alcoholic or struggling with alcohol or detoxing. So there is counseling, there is inpatient rehab, outpatient rehab, support groups such as Alcohol Anonymous, Narcotics Anonymous if she was withdrawing from drugs. Some of the assessments as a nurse that I feel like that would be done is just the routine alcohol screenings. So testing blood, testing their alcohol levels. Are they alert, looking for the signs and symptoms that are associated with alcohol withdrawal? And then also assessing from the DSM standpoints, like are they meeting those criteria? There's also the Clinical Institute Withdrawal Assessment for Alcohol, the CIWA. So that also, I'm sorry, I'm reading from a piece of paper. That looks at, is there nausea and vomiting, tremors, are they having sweats, is there anxiety, agitation, tactile disturbances, auditory disturbances, visual disturbances, are they having a headache or that feeling that your head is just full and wanting to explode, and how are they orienting? And also just, a great opportunity, like I said, for help is going through some sort of treatment, whether it's individual counseling, group therapy, support groups, whatever it is, but just to help everyone, whoever's struggling to get out there. There's definitely resources. And I will attach all of my resources to a email because I didn't know exactly how to read all this on there. So thank you for listening, and I hope I got the question right. Thank you. Bye.